Good afternoon. Today we're going to provide an update on testing, hospitalizations, and PPE distribution. I also want to share some updates on the traditional unemployment system and the new pandemic unemployment assistance program that launched here last week. With respect to testing, yesterday's report recorded 9,613 tests conducted in Massachusetts, and the number of new confirmed COVID-19 cases came in at 1,840. That's about 19% of the tests conducted tested positive. We obviously continue to watch that as well as the hospitalization rate data and the hospital capacity data very carefully. As of April 28th, there were 3,875 patients hospitalized statewide for COVID-19. That's a small decrease over Monday. Overall, our hospitals have had roughly this many COVID-positive patients in their facilities for the past 14 days. That's why I said hospitalizations around COVID-19 patients have been flat, which is better than the sharp spike, but it's not falling at a consistent rate either. Currently, about 7% of those who test positive require hospitalization statewide. Hospitalization rates have actually also remained relatively stable, ranging in the 7 to 10% range for the past several days. What this means is that people who test positive for COVID, only a small number get sick enough to need to go to the hospital. That's certainly the good news. Massachusetts hospitals, as I think most people know, significantly increased their bed capacity and now have over 18,200 beds available across the state, including the temporary field hospitals. 54% of those beds remain available for patients. But I do want to say again that as we talk daily with our colleagues in the hospital community, they have seen an increase in people going to the hospital, going to the ED for reasons that are not related to COVID. This continues to be important. As we've said before, a big part of what we did here in Massachusetts to increase capacity and prepare for the increase in COVID-19 hospitalizations was to work with the hospital community to make sure they would be able to continue to serve people who needed it that weren't related to COVID-19. The two other points I'll make, number one, is that people have embraced in many cases on both the clinical side and on the patient side telehealth, which we made available under an emergency order here in Massachusetts back in March. Conversations with folks both on the provider side and on the insurance side have proven that, in fact, people do appreciate this benefit, they do chase it, and they do use it. And there's a tremendous amount of satisfaction among both clinicians who are using it and patients. And I would urge people to continue to reach out to their clinicians either by phone or video chat or whatever the appropriate mechanism is if you feel like you need to talk to your doctor. And of course, we always want people, if they feel ill, to make sure that they don't put off necessary health care. It's important that people recognize and understand that the system is there for them. When we had 3 hospital CEOs here last week to talk about this issue, the folks from Bay State Medical said they had 150 COVID patients at that time, and they had 400 people in the hospital for other reasons and other issues. And they also had available capacity to serve others if it became necessary. It's very important that people recognize and understand that the healthcare system is there for them and will be there for them as we work our way through this. With respect to PPE, personal protective equipment, we've now distributed over 6.8 million pieces. That includes masks, gloves, gowns, and ventilators, which have been distributed to healthcare organizations, healthcare workers, first responders, nursing home employees, and others. And we continue to aggressively pursue all supply chain avenues available. And yesterday, as you all know, we extended the closure order around non-essential businesses until May 18th, which was, of course, we believe, a necessary step to push back against the virus and protect our healthcare system, recognizing that we have not yet seen the downward trend that virtually every analyst, public health expert, federal official, and CDC official has said is a critical part of making the decision to move ahead and reopen. That's also, by the way, one of the major criteria that virtually every state is using when they make these decisions, and most other countries and provinces have used as well. We also launched, as we said yesterday, our Reopening Advisory Board, which is focused on planning for that safe and responsible return to a new normal and the economic recovery that we will all work hard to deliver on after that. And as we said yesterday, that group is co-chaired by Lieutenant Governor Karen Polito and by Secretary of Housing and Economic Development Mike Keneally. They hit the ground running and held their first meeting. It was a virtual meeting yesterday, and their plan will continue to develop over the course of the next several weeks. But the goal here is to develop guidelines for businesses to start a phased-in approach to reopening safely. The decision on when we'll be ready to start implementing this plan, it will be dictated, however, by the public health data and the hospitalization data and the other sort of key elements that many others are pursuing and informing their decisions with, not just here in Massachusetts, but across the country and across the world. We are still, as we've said before, at the plateau with respect to the surge, and as your governor, we are always going to put Massachusetts first. We'll be ready to move on from this stage of our lives, but not until we actually see the data that demonstrates that it can be done and done appropriately. Moving too quickly runs the real risk of creating another outbreak, which will put people out of work, overwhelm our healthcare system, and put us right back in the public health crisis that we have all worked so hard to get out of. When we take a step forward, we don't want to take 2 steps back. As the advisory board continues to meet, we'll obviously update you on their progress. But in the meantime, there's still a lot of people out of work who need help. Our administration continues to work hard to get people the unemployment benefits that they need to help their families through these difficult times. And in just a few short weeks, we created and grew an enormous infrastructure to help people who are suddenly out of work through no fault of their own. That's been done both through the traditional unemployment assistance program and the new pandemic unemployment assistance program that was created by the CARES Act. Today we have an update on both. First, with respect to the pandemic unemployment assistance program, this program, you may recall, was created to help workers who don't fit into a traditional category that would make them eligible for traditional unemployment benefits. That includes people like independent contractors, the self-employed, and other workers who participate in the so-called gig economy. The federal government enacted the PUA program with the passage of the CARES Act, but left it to the states to implement the program. Our team worked incredibly hard over a very short period of time to stand up what was basically a brand new platform to serve a population for which we didn't know very much about how much they made, who they worked for, and didn't have a running tally on what they were being paid week by week, which you typically get through the traditional unemployment system. Massachusetts became one of the first states to successfully launch this program and start paying claims. So far, the system has seen well over 150,000 applications, and as of today, has paid out nearly $500 million in benefits to the people who've applied. These benefits include the extra $600 a week that was part of another federal CARES Act benefit which we implemented. The PUA program also has a robust customer service component, including a call center and an online chat bot that makes it possible for people to communicate through common issues on the application process and to actually learn from that and make adjustments to how the system works going forward. In just over a week, that PUA call center has connected with nearly 80,000 constituents over the phone, and the online help tool has helped resolve over 200,000 individual issues that people had when they were applying for benefits. The successful launch of this program is another big step as we continue our work to help make sure that those who are struggling with the loss of a job due to the COVID-19 pandemic and the decisions that have been made since then get the help that they are eligible for and entitled to. And we'll continue to pay out benefits for workers who don't qualify for traditional unemployment through this PUA program. People who think they may qualify can learn more about it at www.mass.gov/PUA. I also want to provide an update on the traditional unemployment system. Last week's numbers indicated that over 650,000 people had applied for traditional unemployment since this crisis began. The Department of Unemployment Assistance has been paying benefits to an unprecedented number of people as well. As of last week, the state is paying benefits to over 400,000 people. Managing this volume of claims and applicants, which literally is about 10 or 15 times as high as it's ever been before on the new claim side, has required DUA to exponentially expand their operations, and they've risen to the occasion. In March, DUA had a 50-person call center. Today, they have 1,200 people working in a call center that operates remotely to help people work their way through the application process. That number includes nearly 60 City of Boston employees who are helping out with the call center as part of a partnership with City Hall. We're very grateful to Boston Mayor Marty Walsh and the city for this support, including the employees who are now working on Spanish language customer service operations. The customer service component of the traditional unemployment system also includes our daily virtual town halls, which help people through common issues on the application. To date, these have been attended by over 200,000 constituents, with town halls available in both English and Spanish. The Department of Unemployment Assistance is going to continue to work overtime to help people with both of these unemployment programs. And there's no doubt there are challenges, but they are doing everything they possibly can to make sure that we meet them. There's much more to do, and we'll keep at it, because making sure workers get the benefits they're entitled to is a critical part of how we deal with the very real economic impact of COVID-19. The last several weeks, I think, as we all know, have been challenging for everyone, and there are probably still some hard days ahead as we get through this particular surge. But in the midst of all that hardship, we have been making progress that's helping us get through this pandemic so that we can return to what we would call a new normal. As I mentioned before, the Reopening Advisory Board will support our local economies to come up with an ensemble of sensible strategies and parameters for stores, businesses, and other operations so that they can safely reopen when the data permits us to do so. We've also made a lot of progress on testing and tracing. When we first started testing, we were testing less than 1,000 people a day. Now we're reporting an average of about 8,000 to 10,000 tests a day to better understand the infection rates associated with the virus. And our contact tracing program, which was the first in the nation to launch, has helped slow the spread of COVID-19 and helps people make thoughtful decisions about when, where, and how to live out their time in isolation and to make sure we get in touch with their close contacts. Hospitals have stepped up to expand capacity, to rethink their daily operations, to care for COVID-19 patients, while also attending to the ongoing healthcare needs of others. And because of this, we've been able to meet the demands of the surge, something that in many other countries was a monstrous struggle with some really unfortunate consequences. Our frontline health workers obviously have totally stepped up to the plate on behalf of all of us, as have our first responders, our transportation employees, public transportation employees, grocery store workers, and so many other essential workers who stood up time and time again to make it possible for the rest of us to continue to live through our daily lives. And most importantly, the people of the Commonwealth have done a terrific job of staying at home, of socially distancing, of maintaining good hygiene, and doing all of the things we need to do to make sure that we continue to bend the trend and stop the spread. I want to thank you for all you're doing. We're in this together, and we are quite sure that because of all your hard work, there are better days ahead.